Hey Future Medics, Tina here, your medic mentor, and today we're going over a medication you've probably taken yourself more times than you can count, acetaminophen, better known by its brand name, Tylenol. Tylenol is an analgesic and also an antipyretic, meaning that it is used for pain control and also a fever reducer. So unlike NSAIDs like Ibuprofen, Tylenol will not lower inflammation. Instead, it works in the central nervous system to block pain and reduce fevers. In EMS, we're going to give this for mild to moderate pain and in febrile patients. But do remember that a temperature is not a fever until 100.4 degrees Fahrenheit. The typical adult dose is 325 to 650 milligrams every 4 to 6 hours, with a max one-time dose, so a max dose of 1,000 milligrams or 1 gram. That differs from the daily max, which is 4,000 milligrams. So usually we do about 325 to 650, but the most you can take at one time, max dose, 1,000 milligrams, that 1 gram. And then for the day, because remember Tylenol is pretty dangerous for your liver, so for the day's accumulation in 24 hours, the max daily dose is 4,000 milligrams or 4 grams. You might also see this dosed for kids at 15 milligrams per kilogram. Whenever you see that milligram per kilogram, we call it mgs per kg. So 15 mgs per kg, I just want you to know it. When you hear it, you'll know what's going on. Mgs per kg, we'll get the dose based on the child's size. So you might also see it dosed that way. The route is IV or IO, PO, or the first time we're seeing this one, PR, which means per rectal. When we're giving it rectally, it's usually small children like infants. It's not something we're usually doing with adults, but PR is that per rectal route. This will kick in about 10 to 20 minutes, and it lasts 4 to 6 hours. Side effects are minimal when used appropriately, but one major problem that we see is liver toxicity, because this one is metabolized in the liver. So when you're on scene and you're asking a bunch of questions, you need to ask about other medications your patient might be taking, because if they've been sick, they may be taking an over-the-counter cold or flu medication, which could have acetaminophen in it. Things like NyQuil cold and flu, or even the DayQuil cold and flu, those ones, when you read the label, contain acetaminophen. So you need to know that and when they last took this so that we are not overdosing them on Tylenol and then causing liver damage. Contraindications are going to be liver failure, known hypersensitivity, and alcoholism. And that alcoholism is because it's already putting so much strain on the liver, we don't need to place any more. Here's your takeaway. Tylenol is a pretty safe and very effective medication, but we need to respect those dosing limits. It's incredibly important. Make sure that you also are looking at other combination medications which might be hiding acetaminophen in it. We need to be safe with this one. That's another one knocked out. You're doing such a great job. I'll see you for the next one.